We are live now.
Assalamu alaikum. Good evening, everybody. Exciting session. Today, we are speakers brought with an interesting topic, minimally invasive implantology. Our honorable speaker is Dr. Hani Bey, Senior Researcher of IBS Implant College of Dentistry, Letuvas, Seikatus, Moxlu. Thanks for allotting time for us, ma'am.
Thank you.
Uh, Today, our respected expert panels are Dr. Rajiv Kumar Bonik sir, BDS, MS, Assistant Professor, Department of Prosthodontics, Bangabandhu Sheikh Mujib Medical University, Dr.
Hello.
Dr. Riyad Mahmood sir, BDS, MS, Prosthodontics, Bangabandhu Sheikh Mujib Medical University, our honorable representative, Mukhametov Ainur, Regional Sales Manager of IBS Implant. Our honorable guest is Professor Dr. Jahid Hussain Sir, BDS, PhD, Professor of Periodontology, College of Dentistry, Nazran University, Saudi Arab. Thanks for IBS Implant for supporting us. Now I would like to request Dr. Riyad Mahmood Sir for conducting this session.
Thank you very much. This session will be very fruitful, as I know, and this is an international session. First, I'm correcting. That is, I graduated from BSMMU. Now I am a prosthodontics, and I work in my chamber. And my colleague, my friend Rajiv Bonik is here. So I'm asking Dr. Rajiv Bonik to speak on behalf of our basic dental school bond.
Okay, thank you, Dr. Riyad Mahmood. Welcome everybody and good evening. Actually, you know the time in Bangladesh is 7 p.m. It's a very crucial time for us because all of our doctors are busy with our chamber. So anyway, I think this is a good session and very informative and very essential for our junior and as well as our senior doctors. As the world is going on implantology, because in everywhere the world, implant is their prime issue nowadays. And if we think the modern advances of dentistry, the implant is one of them. And I think today our honorable two speakers are there. I think they are very they have will present this session in a very rich way. So our audience and we from basic dental school and in Facebook lives, all of our followers will enjoy this session. Thank you, Dr. Riyad.
Thank you, Dr. Rajiv Bonik, for your valuable opinion and for giving time at this stage. Now I'm going our foreign delegate to represent themselves, and after that, starting that session. Thank you.
Good evening. Give me a second, please.
Good.
Can you see my screen?
Yeah.
Not.
Can you see my presentation?
No, not yet.
No.
You have to share.
Give me a second. You go.
Do you see our presentation right now?
Yes, it's yes.
Okay, my name is Ainur, and I'm so glad to have an opportunity to start our today's session. Not only because I'm in love with dentistry, but also because we'll be able to take a look on one of the most incredible approaches in minimally invasive implant treatment. To make a long story short, we'll briefly observe background of IBS implant company establishment, compare all pros and cons of unique implant developed, check for education facilities, and last but not the least, we'll answer your questions on how and where to get it on the best deal. So, straight to the point. Implant surgery has shown marvelous advances with progress in medical technology. However, complicated technique and damage inflicted upon patient did not show much improvement. Among global companies, there's an implant company that expanded into global scale company, setting a new standard to the market. We are IBS Implant. In 2003, Dr. Wang, a dentist, had a doubt on conventional implant surgery and started an implant surgery research for minimally invasive surgery. After endless research, he developed Magic Surgical System, and in 2008 founded IBS Implant to produce, educate, and distribute the product that would satisfy new paradigm. IBS leading innovation and global standard R&D directly manage not only Korean subsidiary, but also US, China, Vietnam, and Europe, rising its position as an implant company that represents Korea. By holding annual symposiums, we have agreed upon MOU with dental colleges and in various nations, put our best effort to make IBS implant system as a world core technology. Unlike conventional implant system that makes incision on gum, IBS implant system allows flapless surgery and personalized surgery based on condition of patient, including bone density, bone mass, and anatomical structures. It has overcome the merit of conventional implant system, allow everyday life after surgery, and has faster recovery period. We have established state-of-art manufacturing system for collaborative research with clinical doctors and for safety of patients, realizing an efficient production and global level quality with precise quality inspection. IBS International Clinical Education Center provides theoretical education on flapper surgery and various practice optimized for minimally invasive surgery that can only be seen in the center. Even doctors unfamiliar to flapless surgery can easily perform the surgery after a session and are making a good outcome as of now. IBS owns multiple innovative patents for its implant design, thanks to the global level products and technological capacity, which at their excellence being appreciated with ICL, CE, and FDA approval. IBS has acquired intellectual rights with incessant research and technological innovations, and it continuously trying its best for its goal to become the world's first implant company in research, production, and education. IBS creates a new paradigm for implant. Every step from Korean number one towards the world best is made with effort to bring healthy and more beautiful tomorrow. IBS implant. And now let me introduce our speaker, Dr. Hani B, the senior sorry, the senior researcher of IBS implant. She graduated from College of Dentistry, Lithuanian University of Health and Science. Uh, Dr. P, the floor is yours.
Thank you. So, hello, fellow doctors. My name is, as he introduced me, my name is Dr. Hanibe. And now I am here to make a presentation about the minimally invasive implant treatment. I know that a lot of you doctors are already familiar with the concept of minimally invasive implant treatment. However, us AMI, which is a short for the Academy of Minimally Invasive Implantology, we have a quite new concept of minimally invasive implantology. Uh, most of minimally invasive implant treatments, they only talk about the flapless surgery. But we don't stop there. We have mainly four goals of our concept of minimally invasive implantology, which is first, to minimize the damage on the soft tissue, and second, minimize the damage on the hard tissue as well. And for number three, we're going to minimize the number of surgery. This will be the similar concept of the flapless surgery. And four, we're also going to minimize the use of artificial materials such as bone grafting materials or the membranes. So let me show you. This is a IBS implant, which is called the Magic Core. And this type of implant is optimized for the minimally invasive surgery. And as you can see, it has a quite new shape and it's like very new, right? So let me briefly talk about each part from the bottom. So from the bottom, the thread, it's called the magic fin thread. Uh, the G is okay. Anyway, it's called the magic fin threads. And as you can see, this is surface treated area. And what is unique about it is that it has a square rectangular shape of the thread, and it's very thin and long. By making it in this shape, what we are trying to do is that we're going to take the initial stability by the morphologic contact rather than the crushing and fixation method. And second, because the thread is very long and thin, we have the optimized ratio between the implant titanium and the peripheral bone. So the ratio is roughly 1 to 9. And that way, we're going to preserve a lot of inter-thread bones between the threads. And on top of that, we have the magic cuff. This is machined surface, smooth surface. This is the part where the soft tissue will be adhered. And it's like the color of the tissue level implant of like Stroman and stuff. Here, because it has very small diameter, we're going to have great gingival seal, which is going to be great help for the bone to be healed underneath. And on the very top, this is called the magic post. This is where we're going to connect the abutments or connect the crown itself there. And this is not on the soft tissue level. This is actually above the tissue level. Let me go deeper into it. So yes, what I'm going to do from now on is I'm going to talk about each parts of Magic Core. And like the slide before, I'm going to start from the bottom. So I'm going to talk about the threads. So when we talk about threads, we want to compare this type of magic fin thread to the conventional triangular threads. So as you can see, and I said before, you see that this type of thread, the magic fin thread, has long, thin, square shape of thread. And the conventional thread is very short, has a smaller, short thread depth, and it's also mostly triangular shape. And these are the quotes are they are saying the advantages of having a lot of inter thread bone preserved. One of that says like when the thread pitch exceeds zero point 0.8 millimeters, the minimum stress was obtained, so meaning that when you have bigger pitch of the implant threads, the stress will be lower, meaning that because we have a longer space between each threads, we're going to have larger pitch, which will exert less damage on the bone. And this is another advantage of having that type of magic fin thread. On the left, okay, this is the picture of the infinite No. Finite element analysis. I'm sorry, I had to translate that in my head. Finite element analysis. And on the left, you see the conventional bone level triangular threads. And on the right, this is a magic fin thread. And the red surface represents the functional area. So for the bone level triangular threads, the functional surface is always almost 5 millimeters from the top. And on the red area, there is the area where the stress is exerted the most. On the other hand, this is the magic fin thread, and as you can see, all the red area continues to the bottom. Be This happens because it has very long depth and thin thread. What it means is that the longer the what do you call it? The longer length of the implant you have, the longer stress distribution you're going to have, which is going to be better. So clinically, it is possible to apply narrow and long implants with this type of magic fin thread. And this one is about the peripheral bone. As you can see on the left side, this is a conventional triangular thread.
আপনাকে
And
আগে আমি দেখছিলাম।
আমাকে দেখেননি, আমি প্রথম আসছি, আমি আগের কাছে থাকি ভাইয়ের বাসা।
is everything okay? Can I continue?
Yes,
Yeah, okay.
everything is all right. One of our honorable teacher is with us, AKM Sarwar Alam
I
sir.
see, I see. Okay.
Welcome, sir. Okay, please continue.
Okay,
Your active trade.
okay. So on the left side is where when you are placing this triangular thread. As you can see, the thread itself is thicker and shorter, right? And you are going to make the osteotomy according to the core body size of the implant, right? And then you're going to crush the bone while you're placing the implant, right? On the other hand, for the magic fin thread, it's very long and thin. So instead of crushing the bone around the osteotomy, it's going to slice through the bone. So it's going to give a lot less damage on the peripheral bone. It means that you can even have the faster loading time because this is it gave less damage than the conventional triangular threads. And this is a clinical example. As you can see, can I write? Okay. As you can see here, this was the pre-operative picture, and along this yellow line, this is where we presumed that the bone will be healed to that level. So according to that, we placed the implant like this. I know that it looks like the thread is exposing, but we are going to have secure soft tissue seal there, and we're going to expect this much of the bone to be filled in there. And as you can see, voila, it the bone has healed to that level, right? So that was another advantage. And now I'm going to move above is the cuff part. Before I talk about the cuff part, I want to talk about how the soft tissue will become after the placing the bone level implant. And from this picture, as you can see, after you place the bone level implant, you're going to connect the healing cap, right? And after the bone has healed, because you need to take the impression, you're going to disconnect this healing cap and you're going to connect the impression coping in there. And after taking the impression coping, after taking the impression, I'm sorry, you're going to disconnect the coping and reconnect the healing cap, right? While you are performing this type of things, you are detaching the soft tissue seal. You are continuously interfering with the soft tissue sealing. And by the time you put the final prosthesis, and after a few years of the final prosthesis delivery, you're going to everything okay? Okay. You're going to observe a deeper circus here, and once the circus has formed, it's going to become deeper and deeper, and it's going to reserve the marginal bone. So that's the peri-implantitis, right? But let's compare that to the magic core. Magic core, because this is how you place it, you want to have the marginal gingiva here, and this magic post will be exposed above the gingiva. Then you see that after you place the magic core like this, the soft tissue will be adhered to the cuff. And even after you're taking the impression, healing the, connecting the healing cap, connecting the closing screw, whatever you do, everything will happen above the tissue level. So nothing will interfere with the soft tissue adhesion. So even after the final prosthesis delivery, um, the soft tissue adhesion will be protected, and because it is protected, now it's going to even grow further to the top, which is we call own growth effect. So if we have that own growth, because we have secure soft tissue sealing, we're not going to observe any peri-implantitis, and it's also aesthetically satisfying. Let me show you an example. So this is when we first started.
Pardon, please. Pardon, please.
Yeah.
The sound is not clear. If
Oh,
you please say it loudly, it will be audible.
okay.
Thank you.
Is it good
A
now?
bit, yeah, yeah, a bit loudly.
Okay.
Now it is okay.
Oh, great. This is an example. So we placed an implant in a healed ridge. This is something called a guide pin, but I will talk about that later. So we placed the implant, and 2 months after the placement, we started the loading, right? We put the prosthesis, and 6 months after the placement, as you can see here, what we call the own growth happened. The soft tissue not only has healed, but it has extended above the original level, right? Which means that it's going to have great gingival soft tissue seal, and you will not observe any peri-implantitis after this. Okay. This is another advantage of the cuff. As you can see, if you have such bone like this, if you have a narrow ridge of the bone, if you wanted to place the conventional bone level implant in this type of situation, you have no choice but to perform bone grafting here to avoid thread exposure, right? However, for the magic core, because we have this cup part where the soft tissue adhesion will happen, we don't have to perform the bone grafting. Rather, we're just going to use this long cuff implant, and without any thread exposure, we can successfully place the implant without bone grafting, without thread exposure. And this cuff comes in various sizes. The magic cuff comes in 2, 3, 2, 3, 4, 5 millimeters. So you can choose in the various situations. And this is an example. So as you can see, the ridge is very, what do you call it? Narrow. Sorry. The ridge is very narrow, and you can see there's not enough attached gingiva, right? In this case, we're only going to have a minimal incision like this. This is what we call the semi-lunar incision. It looks like the half moon. And then just push that much of gingiva to the buccal side, and we're just going to place the implant like that, without bone grafting, without suture, nothing. So this is a picture of the guide pin. This is what we use before placing the implant. We just wanna check the placing path with the guide pin before placing it. I'm gonna talk about that later. And along this path, we use the implant. We place the implant without bone grafting. Rather, we only use the long cuff, and here on this side will be, this is a buckle. Oops, it's not working. Okay, buckle. And this is lingual, right? So as you can see, this part, the bone is adhered to the smooth surface, and here the soft tissue will be adhered. So this is how we do it for the magic cuff. And lastly, we're going to talk about the magic post. Magic post, obviously, because it is on the top, we're going to connect the prosthesis there. So before that, let's look at how we're going to place the bone level implant. If you want to place a bone level implant in such situation, you're going to have to perform bone grafting here, because you want to place your implant in the red axis here. This is the direction of the occlusive force, and this is the path you want to place your implant, right? But in order to do that, you have to perform bone grafting here, because to avoid the thread exposure here. And if, but okay, let me tell you this first. So if you perform bone grafting here, this is not one of our concept of minimally invasive treatment, because it uses artificial material. And to avoid using the artificial material, you're going to have to place your implant in along the blue axis. This is something we call the bone-driven implant, right? But if you place the bone-driven concept with the bone level implant, then that's how you're going to place your implant, right? If you place your bone level implant along this blue axis, then now you have problem with making the prosthesis. You're going to connect your abutment like this, and because now the direction of occlusive force and the direction of prosthetic connection is very different, we're going to observe the fixture fracture like this picture on the right. That's why we think that the two-piece bone level implant is not optimal for the minimally invasive treatment. However, this is what we do. We want to place our implant in the bone-driven concept because we want to perform minimally invasive treatment. And even if we place an implant along the blue axis in the bone direction, because it has a strong connection on the outside and inside, we have very strong prosthetic connection, and it is okay to fabricate prostheses in such direction, and it's going to survive. Let me show you an example. So as you can see, this is a premolar, and you see that implant was placed in this axis, bone-driven concept, right? Like this. However, you can see that you have to make the crown in this direction, like here. And even if we place the implant like this, it is perfectly fine to fabricate a magic crown in such direction, and it's okay to just connect it like that, and it has survived until now. So that was another clinical examination. And after that, I want to show you a video about like a brief summary of what I just said. And after the video, I want to talk about some surgical techniques that we have for the minimally invasive implantology. Okay, let me. Oops, how do I start this? It doesn't work because I used the pen.
Oh.
Oops. I'm sorry.
Yeah, play it.
Right now. Okay.
Technological advancements in the medical
Okay.
field and devices have enabled us to change the direction of surgery from invasive procedures, which leave large scars, to minimally invasive concepts, thereby reducing damage and pain to the patient, as well as increasing healing speed and recuperation. However, in the dental implant treatment field, procedures are still being done with the flap being opened with a large incision, giving immense damage to the patient. Since the year 2003, IBS Implant has researched and developed an implant system with the concept of minimal invasiveness as the focus. Currently, the IBS implant system is being widely used and is showing successful results both clinically and scientifically. While conventional implants secure stability by fixation, the stability by morphologic contact of the Magicore implant preserves live bone, which makes early loading possible. While conventional implants require a minimum surrounding bone width of 2 millimeters, the Magicore of IBS implant only requires 0.5 millimeters of surrounding bone to be successfully implanted, even without grafting. The thread design of the Magicore allows a 9:1 bone to titanium ratio, which minimizes the differences in rigidity and flexibility between bone and titanium, giving the Magicore implant an advantage in stress distribution and minimizes chances for microfractures. With conventional implant systems, bone grafting is needed in many cases, but with the Magicore's various selection of cuff heights and a shape that enables placement depth adjustments, successful implantation is possible by selecting from a variety of implant sizes, which fit the varying shapes and sizes of each case's bone shape. Upon removal of the healing
Sorry. I'm sorry.
abutment, soft tissue becomes damaged, and both the wound and implant are infiltrated by bacteria. If the soft tissue is repeatedly disturbed, the junctional epithelium migrates downward, resulting in loss of connective tissue mix. Because the gingiva is damaged, undergrowth occurs, the reaction of the body of marginal bone resorption in order to regain the lost connective tissue. On-growth occurs, a reaction resulting from healthy periodontal conditions. The bacteria between the fixture and the abutment multiplies, resulting in periimplantitis. The inner attachment surface of the crown and the innovative outer structure of the core crown is simultaneously attached to the implant, enabling fabrication of a widened occlusal surface with anti-rotation and seamlessly prevents prosthetic detachment that may occur from vertical and horizontal forces.
Why is it continuously stopping?
It's the end.
Oh, is it?
Technological
I'm
advancement.
sorry. That was the end. I thought it was not the end because the speaker didn't stop. Okay, so that was a brief summary of what I just talked about, the characteristics of the Magicore, the implant which is optimized for the minimally invasive implantology. And now I want to talk about some surgical techniques that we have. Okay, so first off, when we are placing the implant in the like basic cases, what we do is something called magic fit drilling and magic implantation. For short, we call it MFD and MFI. Basically, what it is that we are forming the osteotomy in the exact shape of our implant in the first place so that we're going to minimize the damage on the bone, and we're just simply going to place the implant with hand in the already formed osteotomy. So this is to show you how to actually perform that MFD and MFI. Let me see.
Bone quality is diagnosed using the magic split.
Okay. Oh, okay. I'm sorry. I wanted to like stop in the middle. I did, but it didn't. Sorry.
Bone quality is diagnosed
With
using
the
the
magic
magic
split. Okay, what we do here is that we want to diagnose the bone quality. We just want to make sure that it is not a D4 bone quality, because if it is D4, we are not going to use the drill to form the osteotomy. So after that, can I continue?
Pardon, louder, please. Louder, please.
So if the bone quality is not D4, if it is denser than D4, then we are going to use the magic drill. So this is how to check the bone quality here. And then
drilling is performed using the pin drill. Guide pin is inserted.
and
CT is taken to confirm the path and implantation location.
so here we're going to place this magic guide pin. So after placing this guide pin, we are going to take the CBCT so to make sure that this path is correct. And
engage the magic drill onto the guide pin and drill up to 5 millimeters and remove the guide pin.
And then we're going, as you just saw, we're just going to engage the magic drill. Magic drill is a hollow drill so that it is possible to engage the drill itself onto the magic guide pin, right? And
drill using the magic drill to find desired depth. Remove the bone core using the spoon excavator.
because the magic drill is a hollow drill, after drilling it to the full depth, it's going to form this bone core in the inside. So we're going to remove that bone core with the spoon excavator. Let me show you.
Remove any leftover bone from the floor using the depth drill. Insert the magic pin into the prepared implant bed. Remove the magic pin body.
This magic pin is for the tap drill. What does the tap drill does is doing the thread preparation, but we want to prepare that thread in the same direction as well. So we're going to use this. Let me show you.
Engage the magic tap drill onto the magic pin guide and drill slowly, less than 20 rotations per minute. Reverse drill to remove the magic tap drill, then remove the magic pin guide. Place the implant by hand, noticing that the magic core spin thread matches and follows through the created tap within the wall of the hole.
As you can see here, because we already prepared the thread pads, it is very important to place the implant with hand, not to damage any more bone around it.
Place implant to desired depth using the torque ratchet. surgical method would you prefer?
Yeah, that was the MFD and MFI, and that's the very, very basic protocol that we have. Next, I'm going to talk about something called CMC technique. This is a short for crestal approach with membrane control. And as you can see, this is our very unique technique for sinus elevation. Uh, we use the CMC technique when even the residual bone is less than 4 millimeters. I know that in a lot of other cases, when the residual bone is too thin, then still a lot of doctors choose to open the lateral window and take the lateral approach. But in the AMI, in the Minimal Academy of Minimally Invasive Implantology, we think that this lateral approach is too invasive. So what we want to do for the sinus elevation is that we want to take the crestal approach no matter the situation. So let me show you. This is the tool that we use for the CMC technique, and it's very unique. And because of its unique shape, it is possible to perform CMC technique in the very difficult situations. Let me show you how it is done. I think it is easier to see that. So when you have this sinus elevation case, what you want to do first is that you want to remove all the residual bone until there is only 2 millimeters of residual bone left on the sinus floor. Of course, if you have a thinner bone there, then you don't want to drill anymore. You just want to start right away. And if you have 2 millimeters or less of the residual bone on the sinus floor, what you want to do is you want to apply the magic sinus lifter. And as you can see from, I want to use the pen. Okay, got it. As you can see here, as you are applying the magic sinus lifter, it's going to form that much of a bone fragment, and the instrument and the bone fragment are in the direct contact, which means that the instrument will not be in the direct contact with the membrane, so that there is no possibility of the instrument making the perforation on the membrane. And we are going to use the mallet, and we're going to perform gentle tapping. And you can elevate the sinus floor as much as you want to do. And after elevating it, you want to place the bone grafting material inside. And after that, just place the implant. Very simple. So let me show you a clinical case. This is a patient, and as you can see, that day we plan to place on the right side molar area. So we wanted to place number 15 and 16. On the 15, we used a different method. So I'm just going to talk about number 16 in this case. That's like here. So this was the CBCT, and as you can see, the residual bone was very, very thin. And because it was very thin, we used the endophile to locate where we want to place the implant and to check the path. And with the endophile, we took the CBCT, and you can see it here. Okay, so the direction, the path, and the location is okay. So we used the drill, and we made a little bit of indentation. As you can see, it's a very, very small hole there, very minimally invasive, right? So to that hole, we apply the magic sinus lifter, and we perform gentle tapping, and we lift the sinus floor, the membrane, and perform bone grafting here. And then just place the implant like that. So simple, but let me show you the result. Here you see it from the Panorax, and let me show you the CBCT too. There you go. So as you can see, we performed the bone grafting even minimally too. So the shape of grafted bone has a dome shape, and we took the crestal approach, so it's very, very minimally invasive. So this is the pre-op and post-op CBCT view. And I think that's it for my presentation. Yeah.
Dr. Pe, thank
Thank
you
you.
very much. Thank you very much. It was really very interesting topics. The minimally invasive implant treatment was always something that discussed in the world, and it's not just like flapless surgery. It's really minimal invasive. I think it's time to get some questions asked.
Uh, thank you. Uh, Thank you, Dr. Honeybee,
Thank you.
thank you, senior researcher of IBS Implant, College of Dentistry, and Makametov Ainur for bringing your science at the front of us. So nowadays, implant is a part of dentistry, and it's been using since your company. It's a brilliant result came here. At first, you discussed about implant physics and physical properties, also with biological properties,
Yes.
and you shared it some active traits, and in biological properties you showed that how bone grows without interrupting much more structure, though this is a blind technique, uh, but you showed it very good way. And another thing, the single piece implant, that is connection, uh, that is the collar fracture, and also the here the science behind the implant is osseointegration.
Uh-huh.
So can you discuss please some osseointegration
Osteointegration
property?
around the magic core, you mean, sir?
Uh, uh, yes, that the osseointegration properties of your implant with the bone, that is the biological properties. One
Uh-huh.
question.
Uh-huh.
And another question, and in the surgical session, you showed that some drilling protocols, that is like Bicon implant system, and it is collecting bone, that is standard, very gold standard, and you can collect it through your drilling procedure. That's very good. Uh, Also, in sinus lifting technique, you should very minimally invasive. It doesn't need any flap elevation, but
That's
in
right.
SA3 and sinus augmentation 3 situation, where the sinus floor is very minimum, that
Mm-hmm.
is less than 5 millimeter or
Yeah.
8 millimeter, less than 5 millimeter,
Mm-hmm.
is your implant is able to produce the produce the initial stability.
Uh-huh.
Second question, that is first question was the osseointegration, the science, and second question was the crystal approach. You showed the crystal approach, and is it able to um, uh, perform in sinus augmentation 3 or 4 situation? Thank you.
So the
When the bone is D3, D4, is it able to get the initial stability in sinus elevation with CMC? That was the second question.
oh yes. Okay. Okay. I got it. Okay. So the first question was about the osteointegration, right, sir?
Yes.
Okay, so osseointegration is not very different from the conventional type of any other implants too. So, but I think that our implant is better for the osseointegration because we perform minimal bone removal during the forming osteotomy. Though less bone that you remove, better osteointegration, faster osteointegration is going to happen, right? Because you're going to preserve the host bone. That's what we are aiming here. So because we have very
Narrow core
small,
body.
yeah, narrow, small core body, we are not going to remove a lot of the bone, and therefore we're going to have faster, better osteointegration after placing the implant. And I gather that your second question is that even when the residual bone was very thin, is it possible to gain the initial stability in the sinus elevation situation? Is that right?
Yes.
Okay, yes. That was the advantage of the magic fin threads. Because the magic fin thread is very thin and long, it can uh, gain the initial stability even in such situation like this. So I actually removed the picture, the intraoral picture after the placing the implant. What we actually do after placing the implant before using the closing screw, what we always do is we check if it has mobility or not with the cotton plier. So after like if we try to move it with the cotton plier, it doesn't move. It like stays. It fixes in the in this cortical bone right here. If you can fix that one, even one or two threads, and in that cortical bone, it's going to stay there. And
Only two thread.
yeah,
Only two thread.
yes,
That's amazing. Unbelievable.
I can show you the what do you call it? The video actually. If
Yes.
yeah, if you can come to our homepage, there is actually a
Yes.
surgical clinical video. You can see the whole procedure.
Thank you. Thank you. That's a great science. And we are very glad to have our honorable chairman with us. That is the Professor Jahid Hussain, sir. He is from Saudi Arabia, professor of periodontology from Najran University. Jahid, sir, can you please hear us? Sir, mic, please. Thank you, sir. You are audible.
Yeah, I opened the mic. Oh, thank you so much, Dr. Hanibi and IBS. I was a little late to while studying. Sorry, as because the time difference with you and Saudi Arabia, And today we had the university open, so I was sorry for that I was a little late. Anyway, but I enjoyed your lecture and it is great as because you studied in such a way that. I think that this type of implant is coming for a competition with the other companies, as because
Yes.
it seems that it will be easier. But actually, yeah, I wonder that the implant surface have modified to something like I mean, the usually implant surfaces is sometimes it's added or etched or something. So, do you have any such? I mean, you did something
For
with this
in
implant
this
surface?
treatment, we took the RBS surgery.
You treated
RBS.
something with the implant surface.
Yes.
RBF. Okay. And second thing is that as you just put the implant, I mean, how I mean implant sizes. I mean, what are the minimum? I mean, width and length in comparison with the
Okay,
other
let me
implant
show you
systems.
that slide actually. Share screen, right? Yeah. Okay. Application. Hold on a second, please. Yeah.
Yeah, no
Do you
problem.
see my presentation right now?
I cannot see it now, as because I'm watching only the faces now. Because it is not shared. I think
Is
you
it
have to
not
share it
shared?
again.
Yes, it is.
Okay, yeah, it's okay now.
Do you see it now?
Yeah, yeah, I can see
Okay.
now.
So, yeah, so basically this is the diameter of the implants and the fixture length there. So as you can see, the minimum diameter of our fixture is 3.0, and for 3.0 and 3.5 diameter of the fixture, the length comes in 11, 13, and 15 because they're narrow and long implants. And starting from 4.0 implant, this is our basic line, so to say, and it comes in lengths 7, 9, 11, and 13. That's only the fixture length. That's the surface treated length, and the cuff length is a smooth area. So what we for the total length, you want to add the cuff length plus the fixture length.
Okay, thank you. I got it. Regarding your cuff area, I saw that it looks very plain. So, do you think here how bone attached in this area, the cuff area?
For that, sir, actually, when the first implant was invented by, what is his name? Brandmark. I'm sorry. Okay. The first implant was actually with the smooth surface. The first implant did not have the surface treated, as you already know, sir. Uh, Even in that situation, they had the osseointegration happened around around the fixture. So we obviously think that there is no problem bone attaching to the smooth surface area, sir.
Okay, thank you.
So, sir,
Yes.
sir, can I
Okay,
add something?
okay, please.
Sir, thank you very much for giving me a opportunity to share. That is, as we come to know, that is the surface area over the crest of the bone sometimes cause very gather plaque accumulation of plaque and contamination. Therefore, nowadays scientists are producing some implant that is very smooth in the in the collar area, in the gingival area. That's
Okay.
why they combined the science and they increase the active thread. That is the
Okay.
bone implant. The bone implant, sir, the bone
Yeah,
implant
okay.
ratio.
Understood.
The bone
Understood.
implant
Yeah.
ratio, and
Yeah.
another thing, at the very first, there was some in the root form implant. Some problems is there. That is the plaque and other materials are accumulated in the behind the pocket. Therefore, peri-implantitis and other problems go on. To recut this situation, they nowadays every implant are closing the rough surface. They are producing smooth surface instead. Thank you, sir. Am I
Okay,
right?
very right. Very nice. Yeah. So actually, I got it. The advantage is that you made postcode together at the cuff, and it becomes stronger than the other type of joints. Yeah, it's good. It is the advantage, I think. But how much when you started this type of magic? Your core. How long before and how many studies you have to prove that it can compete with the other system, Brainmark or other Micron systems?
I didn't get the question.
You don't get it?
I'm
I mean, the
sorry.
comparison, your studies with your magic, this type of IBS implant,
Yes.
as you, how many studies you have to just prove that these are the significantly, advantageous than the other type of uh, implant systems in the world now going on. So, as because you need a stronger evidences with the studies so that you can strongly say that yeah, we can go ahead with this IBS implant.
I see. The company has established over 7 years ago, and we have selling the Magic Core, this type of what do you call it, implant, over 7 years now. And
Okay.
in Korea, um, obviously 7 years ago nobody knew about the Magic Core, but now the picture is quite different here, sir. We are a very rapidly growing company, and as far as I know, for the last 2 years, we have grown more than twice as much each year. So that kind of
Okay.
proves how much Korean doctors are already, um, you know, um, that's the testimony of how it is actually proving.
Oh, it's okay. I got it. But we need the results. You have to make your results, study the follow-up results, and
That's
in course of time, it will come with the implant. Success and failure rate. You can
exactly.
just then, yeah. So I think we have to wait for more, as because once we started implant with the new system, you need more and more. Studies to just, and we have to go another few years to get the real picture of this new invention. So thank you so much, Dr. Yeah.
Oh,
Anyway,
I just wanted to say that we already have long-term follow-ups up to 5 years. So that's kind of the proof I wanted to say.
yeah, but we need to know some. I mean, what are the artifacts you got it during this procedures or in the whole procedure starting to end, and also the follow-up things. I mean, so we need the results with the comparison results with the other types of implants regarding peri-implant diseases and stability, implant success and failure as well. So
That's right.
anyway, just we have to wait to see your results. Maybe another few years.
Yes.
That's all. Thank you so much for your great, I mean, invention and presentation. We got it. As I am living outside of Bangladesh, but I have good communication with the, dentist of Bangladesh. So I think this will have a great impact in our country also as well. As you know, Bangladesh is a very growing, developing countries, and our dentists also very smart to just take a new advantage, a new, new what I say, new technologies we are trying to adapt in our dentistry practice. I hope that this will give a great impact in our dentistry practice in Bangladesh.
Thank you.
You're most welcome, Dr. Riaz.
Thank you, sir. Thank you for giving us your valuable time. Sir, we have another question.
Yeah.
That is the about the collar. You
Color.
showed that there are some advantage of screw retin prosthesis. That is, there are some angulated abutments, so we can pay some angulated abutment. But in case of single piece implant or one piece implant, is your neck is bendable?
Yes. Okay. Let me show you that picture now. Do you see my presentation, sir? Yeah. Okay. So actually, in this picture, I just showed you with the magic crown, which is the crown that we use without any abutments here. But actually, it is possible to connect abutments in between too. This is just an example that we didn't use an abutment, but we do have a variety of abutments that we can give any angulations or any heights as well. So you can connect abutments above with the angulation with various heights.
Oh,
The
that is the. Oh, thank you, thank you.
yes,
It is. It seems to be dual. So we can place crown or prosthesis, or we can add some abutment.
that's
Am
right.
I right?
Yes,
So that's great. That any angulation is possible here. No chance of fracture, collar fracture.
you're right,
Your
sir.
next slide. Your next slide, there was a collar fracture. You showed in the yes, in the next, there was some collar fracture, but in your system, you showed there less collar fracture. Yes,
That's right. This one you're talking about.
yeah,
Uh-huh.
that's a feature. Yeah, and screw loosening. Is there any chance of screw loosening?
There is dramatically less chance of screw loosening because the screw is not the part that takes the occlusal force on first. Because we have this post part, the occlusal force will be exerted on the post part first, so it's not going to put too much force on the screw part, and there's going to be dramatically less screw loosening, sir.
Thank you. Do you have any study,
Any
Studies.
any physical properties study? That is the, yeah, as we know, the screw acts like a wedge.
I
So
see.
while we place the screw, that
Mm-hmm,
acts like a wedge, and there is during occlusal force,
mm-hmm.
crown collar fracture occurs or screw loosening occurs.
That's
So
right. For those materials, if you contact this contact information, any inquiries, they're going to send you all the evidence and the study results and so on, sir.
then you have the studies over there. You have the physics. Yes.
Yes.
Thank you. And another thing that is, if though it is a single piece implant, what about the gingival height? If the gingival height or soft tissue height is about 4 millimeter, what kind of implant can we choose? And if it is aesthetic, that is, it is 2 to 3, 1.5 millimeter, is there any option?
Are you talking about when the soft tissue is like
Soft
aligned?
tissue height, yes. As it is a soft tissue, this is a tissue level implant.
Yes.
Yes, then the soft tissue issue. Yes, please.
As you can see from this slide, we have various lengths of the cuff, so you can choose from 4 different sizes, and that almost covers every case, sir.
Is there any chance of showing the margin in case of the anterior tooth?
We do have the picture, but I just didn't include it in my presentation. So for that too, if you contact our representatives, then they're going to send you all the pictures you need, sir.
Yes, that is it aesthetic?
Oh, of course, yes. It's much more. Trust me, yes.
Thank
She
you, thank you.
showed. She
That was
showed.
a
Yeah.
nice.
She already showed
Yes, sir.
one. I just remember one picture in her. I mean, slide. She showed that by the elapsing time, it covers. Yeah, this one. And she showed that after
Sir,
6 months, you see 2 months after implantation and 6 months after placement, it different. You see 6 months after it become a grown up, the gingiva covered. So it looks that it is advantageous. I mean, for than the other, and because
sir, it is
mostly we
posterior
suffer.
tooth, sir.
Yeah, but mostly we suffer from that after a few years. Usually, most of the implant they show the color, and it become aesthetically very bad. We don't care about the posterior side, but anterior side it become really, I mean, embarrassing for the patient. So nowadays, implant become troublesome for this reason, because many people they don't know how to take care at home, and for this reason, implants. I mean, somewhere it become some places become losing their popularity due to these things. That's because implant with the implant, most of the cases it is a developed peri-implant diseases after a few time, after maybe 1 2 3 years. So I don't know what about these things, but it looks good. But we need more longer. Follow up results. Please continue these things and continue relationship with our basic dental school bond, so that after 1 year, 2 year, 3 year, we just get your results regarding this, such a things.
Yes,
Thank
sir.
you so much. Thanks again.
Thank you, sir. Thank you for your valuable opinion.
Yeah.
Sir, in case of full mouth rehabilitation, as it is minimally invasive and blind procedure, in case of full mouth rehabilitation, can you assure us that we will use it with cantilever, just like all in 4 or all in 6, or prosthetically double bicortical engagement?
Of course,
Am I
sir.
clear?
If if I could get your questions before my presentation, I could present you all the pictures, all the evidences that you need. But I just like excluded those pictures in my presentation today because of the timing issue and everything. But if you contact those my representatives, honestly, seriously, we have a lot of full mouth rehabilitation pictures. And actually, as a matter of fact, in Korea, we are conducting all the education programs. In one of our education programs, actually, one lecture is about the full mouth in rehabilitation with this type of implant, sir.
I think Riyadh, okay. I think
Okay.
we have another
Sir,
another
sir,
program I
second
have.
part, sir. Oh, thank you, sir.
Is clear
Sir,
as
ওইটা
because I have
বলছে
another yeah.
Thank you, sir. We
You
have
have
some query.
you have another lecture you have now after this.
We will.
No, sir, we have
Sure.
no problem, sir. Sir, another question. The hollow grill, Dr. Sarwar, sir. I can see it. Dr.
Dr.
Rajiv Bonik is here. Now
Yes.
the hollow grill. That
Yes.
is the question of the how much do you owe this implant? How much will you charge for this implant?
How much?
Just
The
like
price,
on an average, you don't have to
cost,
disclose your.
cost.
That is the cost.
the
What is the
cost.
cost? Yes.
Cost varies from countries to countries, and actually I am the representative of the academy, so for the cost and the pricing issues, could you please contact our representatives, please?
Thank you, sir. Sir, please.
Okay, can Dr. Riyad bhai, sorry, can I ask a question?
Please, Dr. Rajiv Bonik is
Okay.
here.
Thank you, Ms. Hanibi, for your nice and excellent presentation.
Thank you.
So I have a query. You showed so many cases that you have done or by your own company, that IBM Imprint. So I have a query that to you. That is, what about immediate implant? So do you have any magic of the Magicor in case of immediate implant?
Sir, actually, Magicore is specialized in immediate implantation. And that is the major part that we conduct, the major lecture topic that we conduct in our education courses. We have tons of evidence for our immediate implantation. That's our specialty. And I am most sorry that I did not include that part of the lecture in today's lecture. I just wanted to show you the overall system of overall things of our system because it is the first time that we talk about this system to you. But honestly, for immediate implantation, we have evidence more than anything. So that also, I'm so sorry, but if you contact our representatives, we're going to show you thousands and tons of evidences and the pictures and clinical cases and the clinical videos and whatever you need, sir.
Okay, thank you. As you have a from an implant company, and there are multiple implant in our today traditional market. So, Dr. Professor Jahid also asks. So, it needs so many research for these new techniques. So, what about in case of complete edentulous arches? So, like all in four, like all in four implants. So this is a very successful. So do you have any options like this type of implant system in case of
Yes, sir.
fully
That
edentulous
too.
job?
That too. That also. Oh my goodness! I really didn't know that our Bangladesh doctors are going to ask all this variety of questions. If I only had knew about this, then I could prepare all the evidences. But right
Okay.
now, like I did not include the part in my
Please
presentation.
please be prepared.
I'm sorry.
No, no, it's okay.
Do you use cantilever or do you use posterior abutments?
I'm sorry.
In all mouth, full mouth rehabilitation,
Yes.
you use cantilever or posterior abutment, like bicortical.
Oh, we can you can do whatever the rehabilitation that you choose. Magicore is not the only product that our company has. We have something else for the overdentures. So whatever, like if you choose to have like all on four, all on two, or the overdenture, all the just full mouth rehabilitation,
That
we
is
have.
hybrid prosthesis.
Yes,
Hybrid prosthesis.
yes.
So Magicor is specialized for hybrid prosthesis.
It's not specialized for it, but you can use it, and we have other products as well.
Oh, I see. Rajiponi, please.
No, I actually asked Hanivi 2 or 3 questions, and I think she will prepare this and we will be very glad to see in future in her lecture. And
Thank you.
what she has presented today, we are happy. That is, thank you for nicely presenting today. Thank you, Anivi.
Thank you.
Thank you, Dr. Rajiv Bonik, for your valuable time and opinion. I also thank Dr. Hanibi for bringing this such kind of minimally invasive implant dentistry introduced in Bangladesh, and also thank our honorable chairman, Professor Jahid Hussain sir. Sir, honorable sir, for giving us time, though he has very less time. Uh, please, sir, can you say something about implant, minimally invasive implant in Bangladesh? Jahid sir.
Thank you so much. Thank you so much. Actually, yeah, it's a great chance that you can adapt in Bangladesh, because I know that a considerable number of dentists they had a training on implant systems, and they started maybe it is very recent. Maybe a few years ago, we started the implants in Bangladesh, and also we are on the process of our study that how much we get different systems with the implant stability, success and failure. Maybe it will be adapted. It can be adapted in Bangladesh, as because we need a much more, I mean, campaign regarding the system in Bangladesh. And I think basic dental school bond is just it's a beginning. And with such I mean, this type of presentation, you can continue more, and you can just discuss in our Bangladesh dental society and Bangladesh, who are I mean, mainly who are, I mean, dealing with the implantology in Bangladesh. So I hope that you can encourage Bangladeshi dentists and periodontists who are interested and who are doing this implants in Bangladesh. I hope it will encourage our dentists to adapt this system in Bangladesh. But as I told you, that we need more studies, and as well as we need, I mean, training programs if possible. You can arrange some online workshop, or and I think after this pandemic situation also, um, we can do some live surgeries in Bangladesh also. So I hope that Basic Dental School Bond will take more initiative in this regards with different organizations they are working in this field. Thank you so much for this. I mean, time, Dr. Hani B, and also your, I mean, associates, and wish to see you more in future with more and more information, and hope that will be beneficial for the dentistry in Bangladesh. Thank you. Thanks again.
Thank you very much. My recommendation is, like we shared our contact information. You can send all the questions, like everyone can send the questions, so we can summarize them and maybe make another course based on exactly what is needed for the Bangladesh
Okay.
dentists.
Thank you so much.
Pardon,
I
please
think
loudly. Please loudly.
Dr. Riyad, I think you can close now.
Yes, sir. So today's session, there was a very good session about implantology and minimally invasive implant. So we have come to the end, and Dr. Uh, Mukha Metov Ainur, Regional Sales Manager of IBS Implant, and Dr. Hani B presented a nice session about minimally invasive implant. They discussed about a lot about implant physiology and physical properties, along with biological properties and the surgical procedure and advantage and other procedures. And thank you a lot. With next, I think it will be a very good session for us. We can ask for next generation clinical sessions, that you can arrange some clinical sessions. We have lot of queries about all in 4, all in 6, and full mouth rehabilitation cases, how we stabilize these cases. Thank you very much, and we hope that you will come in our market with the situation where less amount we have to pay for the implant, and the implant will be available instead of losing tooth. Thank you, and
Also,
thank you
thank you
very
very much
much.
for invitation and for your response.
Hope
Have a nice
we will
day.
meet again. Thank you. Thank you.